And I'm glad to be back. I'm sure did you guys miss me? Yeah, I know, I've been away for the last 2 weeks. I was on our summer break where we took our family trip. And we went down to, a lot of you guessed it, we're down in Uruguay and Argentina. So it was a great trip, rounding off the summer with the kiddos before they go back to school. And they're all back in school today. So that's it. Summer's over, kids are back in school, and we are back with Hump Day. So this is the time I get to spend with you guys and of course go over some plastic surgery topics and answer all of your plastic surgery questions. We're here at Pure Plastic Surgery today, and we are going to talk about the combination of a breast procedure with liposuction, all right? And so that is what we like to call here at Pure the Miami Makeover. That's right, Miami Makeover. So it's not the mommy makeover, okay? That's a little bit different. This is the Miami Makeover, okay? So the Miami Makeover implies that we're going to be combining a breast procedure with the liposuction procedure. And so what does that mean? Well, it can be really any breast procedure. The most common one typically for a Miami Makeover is the breast augmentation. So yeah, it certainly can be the breast aug. But then there's other options as well. It can be your breast lift with implants, your breast lift alone, or your breast reduction, which of course always comes with a lift as well. Something that's becoming actually a little bit more popular nowadays is the breast implant removal followed by or at the same time performing a breast lift. So a breast lift and a breast implant removal. So that's becoming pretty popular today. A lot of women are no longer wanting their breast implants. They want to remove the implant. The problem is that if you just remove the implant and do nothing else, then the breast becomes deflated, it becomes droopy. So a lot of times then you want to add that lift factor to kind of, prop up the breast, get rid of that droopiness. And sometimes you can rearrange whatever breast tissue is left behind to give a little bit more fullness to the upper pole. Now, of course, it's not going to look the same as when you had your implants, but it will certainly look better and a lot more lifted and perky than if we didn't do the lift at all. We just removed the implants and did nothing, okay? So those are the options for the breast, and then the options for the lipo portion of it are either a lipo 180 or, of course, the lipo 360. And within any of these, you have the option, of course, of turning that into what we call the HD or high definition liposuction. So what is typically the most common combination for the Miami Makeover? It's usually a lipo 180 high definition of the front, of course, of the abdomen and the flanks and the waist, combined with a breast augmentation. That's the most common one, but any of these combinations are possible. Now, the next question becomes, well, does this apply to everyone and anyone, right? And the answer is, of course, or unfortunately, no. All right, you have to be a good candidate for this procedure, and by that, there's a couple of criteria that you have to meet. Okay, so number one is you have to be on the lower BMI range. All right, because here in Florida, we do have some limits that are set by the Florida Department of Health as to how much liposuction we can do when we do a breast procedure, all right? And so we're limited to removing 1 liter of fat when we do a breast procedure, as opposed to when we're just doing liposuction, we can remove 4 liters of fat, right? So that means that if you're a little bit on the higher side in terms of the BMI scale, then removing just the 1 liter of fat is not gonna do a lot for you, and so you're not gonna be a great candidate for this procedure. It's best for you to stage that procedure at that point, do your breast procedure, and then come back 3 months later and do your complete liposuction procedure so we can remove more fat at one time, okay? But if you happen to be in that lower BMI range, BMI, 20 to 24 or even less than 20, sometimes it can be BMIs of 19 or so, then you'll probably be a good candidate for this procedure. And then the other thing is, of course, we're doing liposuction, and so when we do liposuction, you have to have good quality skin. Right? You can't have excess loose skin. or poor quality skin. So if you've had, say for example, multiple pregnancies and you have that large amount of loose skin, especially in that lower belly area, well then you're more suitable to be a candidate for a mommy makeover, where we're combining the breast procedure with the tummy tuck, as opposed to the Miami makeover, where we're combining the breast procedure with the liposuction. Okay, so you can't have any loose skin. Also, you can't have, I didn't write it here, but in the same kind of vein, you can't have weak abdominal wall muscles. So you can't have weak muscles, and you can't have separated abdominal wall muscles, right? So if your muscles are weak or separated, then you're more of a candidate for a tummy tuck and not just the liposuction procedure, all right? So for the most part, they tend to be younger patients typically who may have not had any pregnancies, and also typically have not had any large fluctuations in weight. So usually it's like a younger patient, maybe in their 20s, who wants to then come, who's on the lower BMI, has good quality skin, and is able to combine that breast procedure with that liposuction procedure, okay? Conversely, if you have loose skin, if you have muscle separation, or if you have weakness of the abdominal wall, then you can still kind of combine the procedure, but not just with the lipo. You are better off combining it with the tummy tuck, because the tummy tuck will then address these issues. The tummy tuck, you'll be able to remove all the loose skin, and we'll be able to do that muscle repair where we bring those muscles back together and strengthen your abdominal wall for that nice, tight, flat tummy. And so that's what we call the mommy makeover, where we're combining the breast with your tummy tuck procedure. Okay? All right, so I think that pretty much explains it, and I'm happy to answer any questions regarding this or anything related to plastic surgery.
Okay, we already have a lot of questions, Doug. First
All right.
one.
Shoot.
For the Miami, I guess the Miami makeover.
Yeah.
Can we add Vaser and body tight?
Oh yeah, so that's a very good point, and I should probably add that on here as well. But definitely, yes, it is okay to add Vaser, and actually, this is actually going to be part of the package, right? So whenever I do lipo, any large lipo 180 or lipo 360, Vaser is now a part of that procedure. It's pretty much mandatory because the results are so great. Vaser provides better skin tightening with less bleeding, less inflammation, and so therefore I recommend it for all my large liposuction procedures. And then yes, you could also add body tight, and this could be added to, whether it's the abdomen, but we can also add body tight to other areas such as the chin, the arms, or the inner thighs. So these are possibilities as well of areas that we can add for the Miami makeover.
Hi, Doc. Can you explain the process for dog ear revisions? Thanks.
So the process is fairly straightforward. So if it's been 3 months after your tummy tuck and you still have a dog ear and you've done everything that you're supposed to do, then you can send photos in for evaluation. We can take a look and then recommend what's the next best course of action. So the first thing though is before, within the first 3 months, you have to be diligent with your compression and your massage. So you see an area that's kind of poking out a little bit, you got to make sure you kind of massage the area twice a day, every single day, and be very diligent about taking care of that. But if it's been 3 months and you've been doing all that and it's still poking out a little bit, then we can make an evaluation. Most dog ears after you do that are going to be very small, which means that it's something that can be taken care of just under local anesthetic. So it's not like a whole big surgery again, general anesthesia and the whole deal, but it's actually just a little kind of quick office procedure where we numb up the area, remove the little bit of excess skin, and close it right up, and you're kind of in and out. You don't even need to bring anybody with you. You can drive yourself in, drive yourself out, and if you're coming from out of town, you don't have to be here like the whole 5 days or anything like that. It can just be one day where you come in and out, and we do it under local, and you're good to go.
Se puede hacer, vamos a español.
Okay, vamos para piqui pani.
Se puede hacer un segundo tummy tuck. Me hice uno hace 2 años y me quedó piel.
Ok, so la respuesta corta es sí, es posible poder hacer un tummy tuck, un segundo tummy tuck después del primer tummy tuck. Lo más común que yo he visto es que a veces alguien se hace el tummy tuck y después queda embarazada, tiene bebé y bueno, ya con el embarazo, ese primer tummy tuck se estiró de nuevo, se estiraron los músculos, se separaron los músculos y se estiró la piel y hay que volver y hacer un segundo tummy tuck. Pero también puede haber ocasiones en cual, por alguna razón u otra, el primer tummy tuck no fue lo suficientemente apretado, quedó exceso de piel y se puede volver a hacer un segundo tummy tuck. Habría que hacer una evaluación para ver si hay que hacer un tummy tuck completo o quizás se pueda a veces hacer un mini tummy tuck o si el exceso de piel es únicamente en la parte superior del abdomen, se puede hacer lo que se llama un reverse tummy tuck y remover la piel de exceso de arriba y subir la incisión hacia arriba por debajo del seno.
Hi, this is a comment.
Okay.
Hi, I love your work. I massage a lot of your pearls from Orlando.
From Orlando, awesome. Well, first of all, thank you so much for helping out our pearls, our patients. Like I've always said, the post-op care is just as important as the surgery itself, and that means massage. So for all our lipo patients, lipo 360 and BBL patients, remember, do your massages, right? You got to do at least 20 massages post-op, and if you're in the Orlando area, go ahead and look her up.
Okay, can an HD lipo be combined with a mommy makeover with a breast lift augmentation during one procedure?
So if you qualify, right? If you're relatively young, lower BMI, no loose skin, then you can combine an HD lipo with your breast procedure and what we would call the Miami Makeover. Okay. Now, if you do have loose skin or higher BMI or whatnot, then you may qualify for a mommy makeover, in which case we're combining the breast procedure with your tummy tuck. Sometimes we can do a little bit of what we call a soft etch with your tummy tuck, where we can kind of delineate some of the lines, kind of that central line, a little bit on the sides here. So it's not like a full HD look, but we can start giving you some of that athletic look. And then if you want that really, really kind of high definition, well, a lot of times then you would have to come back, and you can come back 3 to 4 months later, and then do a complete HD lipo 360 at that time.
Okay, I have done 2 lifts, no implants.
Okay.
Can I have my third with implants?
Sure, it's definitely possible. Now, here's something that everybody must know, right? So whenever you're doing a breast lift, and now you're getting into like your second, your third, number one, most likely you're now going to need an anchor type pattern, okay? Because there may be a reason why the first and the second one failed, which is like you didn't go full on, you didn't have that anchor pattern, you tried to do something with a donut and it just didn't work out, okay? So you're most likely going to need an anchored lift pattern. And so every time that you do a lift, you may potentially lose more and more sensation to that nipple area. So you do have to be aware of that, unfortunately. But every time we're kind of cutting around that area, we're cutting those little nerves, and it is possible that you may lose more sensation there.
You're gonna love this question.
Yeah?
Yeah.
See?
Yeah, porque dice, is there a way to avoid that square shape at the bottom of the breast lift with implants? I know the answer.
You do, yes. Well, we've discussed this before. And remember, first of all, when you're looking at that square shape, take note as to when it is in the post-op course that you're looking at it. Because if you're looking at it within the first 3 months, it's not unusual, okay? In the first 3 months, when you do that anchor lift pattern with or without implants, things will look a little bit square, a little bit boxy, okay? But as the breast starts to settle, as the implant starts to settle, then that's gonna, the implant settles down and then rounds out the bottom of the breast. So the look is not gonna be the same, say, at 6 weeks as opposed to 6 months, all right? Now, so that's really the way to avoid it, or to basically interpret that, okay? Now, is it possible that, even after 6 months, it still looks a little bit boxy? It's a possibility, but that then becomes a little bit more in terms of the technique. You want to, of course, make things fairly tight because you want things to be lifted up, but you don't want to make that kind of central portion so tight that then it won't expand when the implant settles down, right? So it's a little bit, it's a little bit nuanced there, right? You kind of have to predict a little bit how much the skin will stretch, and that's where, of course, a lot of experience comes in, right? So I've been doing this for over a decade now. I kind of, evaluating the patient, evaluating their skin, can make a determination as to just how tight I should be making that lift initially, so that we can have the best result in a rounded bottom to the breast in the future after everything settles.
Okay. Do you have a South Carolina location?
Oof, unfortunately not at this time, but I think hopefully in the future we'll be able to expand Pure to other locations, which would be cool. But as of right now, we do take, of course, a lot of patients that are from out of town, out of state. So we don't have a South Carolina location, but it's certainly, okay for you to come here from South Carolina. We have everything set up for our out-of-town patients. We can guide you through the process, take you by the hand step by step, so that you can come here, have your surgery, and then we get you safely back home as well.
Okay. We have a patient that's in the interview process. She already had her consult with you, but she's a little bit scared.
Okay. So what I would say about that is that it's okay. It's not unusual. It's completely normal to be a little bit anxious, to be a little bit scared. This is not like an easy decision, right? We're talking about real surgery, right? We're talking about surgery under general anesthesia. And that's why it's so important that you feel kind of completely comfortable and knowledgeable throughout the process, which is why we spend so much time trying to inform our patients so they know really what to expect. And that's really the main reason why I'm even on social media at all. The reason why I'm on Instagram and Facebook and TikTok, etc., etc. It's really the primary reason is to educate our patients. And then the secondary reason is so you get to know us a little bit, right? So when you come here, everything's not a surprise, nothing is new, you know what to expect, and that helps relieve some of the fears and relieve some of the anxieties, and also knowing the fact that we're going to be here for you every single step of the way.
Thank you, Doc. Nos preguntan en español que si se pueden arreglar las orejas de perro.
Claro que se pueden arreglar. So, eso es algo que depende de la persona, ¿ok? Pero se puede arreglar de una o dos maneras o una combinación. Depende de qué está causando la oreja de perro. Si es puramente exceso de piel, bueno, eso quiere decir solo que hay que remover un poquito más de piel y por lo general eso se puede hacer bajo anestesia local, muy fácilmente. Ahora, a veces también tiene que ver que hay exceso de grasa. Si hay exceso de grasa, eso requiere liposucción, o a veces puede haber la combinación, un poquito de exceso de piel, un poquito de exceso de grasa, y bueno, se puede volver a hacer la lipo y remover el exceso de piel.
What means gummy bear implants?
So gummy bear refers to the type of implant, and more specifically to the type of gel that is inside the implant. Okay, so implants have gone through several generations now. So the implants that we have today are what we call 5th generation implants, and the gel that's inside is what's called a highly cohesive gel, which means that if I were to cut this implant in half, the gel wouldn't just kind of drip out like a liquid. Actually, it would stay there and retain its shape, because that gel is cohesive. It kind of sticks together, and that's why people call it like a gummy bear. So for example, if you take a gummy bear and you cut it in half, right, each little piece retains its shape, and so it's very similar to that, and that's why these highly cohesive gel implants are commonly called gummy bear implants. These are the best implants that are out there on the market right now. It's the ones that we recommend and that we use. And the good news about these gummy bear type implants is that they are meant to last years and years and years. So you no longer have to go back and exchange your implants every 10 or 15 years like before. Now, if you have your implants and you're doing well and it's been 15, 20, 25 years and everything's okay, there's no need to exchange them. And that's why the companies such as Natrel now offer lifetime warranty for these implants.
How many days do you recommend to stay in Florida after mommy makeover?
All right, so the minimum stay is going to be 5 days post-op. So that your total stay is typically about a week, right? Because you have to come in a day before surgery for pre-op, then you have surgery day, and then you have 5 days post-op. So it's going to be about a week total. But the most important thing is that you cannot leave town. Listen to this carefully. You cannot leave town before your post-op day number 5. Okay?
Pregunta en español.
Yes.
Dice, doctor, una pregunta. ¿Usted quita la manzana de Adán? Esto lo pregunta una chica trans y
Sí.
quiere saber cómo comenzar.
Bien, bueno, esa es buena pregunta y la respuesta es que ese procedimiento sí existe. Se puede reducir la manzana de Adam, que lo que es un cartílago. El nombre técnico, por lo menos en inglés, es el thyroid cartilage, el cartílago de la tiroide, me imagino. Y es algo que se puede hacer para reducir esa área. Ahora, yo personalmente no lo hago. Yo no soy cirujano de cara o cuello. Yo soy más cirujano como del cuerpo. Pero lo primero que yo haría es tratar de encontrar un cirujano facial, un cirujano plástico facial que pueda ayudar con ese procedimiento. Y también hay cirujanos que se dedican específicamente a los pacientes trans para hacer esas transformaciones del cuello y cara.
Ok, doctor, seguimos en español, estamos en español.
Dale,
Quiero
dale.
implantes,
Ok.
pero yo hago cicatriz queloide.
Ujú.
No sé qué le puedo aconsejar.
Yo creo que igual te puedes hacer el implante. Ahora depende si necesitas un levantamiento o no, pero si solamente estás haciendo un aumento de senos con implante, la cicatriz es súper chiquitica. Yo no puedo hacer una cicatriz de 3 centímetros, o sea que la verdad que no te tienes que preocupar mucho sobre quiloide con una cicatriz tan pequeña.
Okay. More questions here, and we go back to TikTok.
Oh, TikTok on fire today.
Todo está on
A
fire.
fuego.
If I have an autoimmune disease, will it be safe to get this type of surgery? Referring to the Miami Makeover.
Yeah, so unfortunately, I typically don't take patients that have autoimmune diseases such as lupus, rheumatoid arthritis, and other autoimmune diseases. Really, one of the main reasons for that is that, because of the disease itself, they tend to not heal well, but also because a lot of the medications that patients with autoimmune diseases have to take, they're immunosuppressant medications, and therefore the risk for infections and poor wound healing and open wounds is higher. And so for all those reasons, I typically don't perform surgery on these patients.
Doc, tuve un tummy tuck 360 hace como 6 semanas y se me está haciendo como una línea hundida en mi abdomen.
Mm-hmm. Bueno,
¿Se disolverá? Ahora, otra pregunta. ¿Se disolverá?
yo obviamente no te puedo evaluar y saber exactamente lo que está pasando, pero te puedo decir lo que yo hago con mis pacientes. Para mis pacientes es muy importante usar lo que le decimos unos foams. ¿Cómo se dice en español? Foams. Son sí,
espumas.
Son como unas espumas
Goma espuma.
que uno se pone en la área abdominal. Por lo general, mis pacientes usan 3 espumas de estas, una al frente y 2 a los costados, para ayudar a que la faja o el binder o cualquier garment que estén usando no vaya a causar esas líneas en el abdomen. Si no lo estás haciendo, me podría recomendar usar estas espumas para ver si se puede disminuir el look de la línea esa abdominal.
Okay, just quick, how they can get a consultation, bookings, because I have a lot of questions about pricing, dates, last dates.
Great. So I know we always get a lot of questions about that. So if you want to know about pricing, if you want to know about availability, actually, we were just, as I said at the beginning, I just got back from vacation, and so we're looking at the rest of the year. it turns out we only have like a few spots left for the rest of this year. So if you want to get your surgery in 2024, you really got to start kind of sending in your information now, because we only have like a few days left, a couple days in November, and that's about it. December is pretty much full because people love December. So yes, go ahead and get that information in now so that you can make sure that you can get your procedure now in 2024. And so the easiest way to do that is to go to our website, which is www.pureplasticsurgery.com. And right there in the landing page, you're going to see a little button that says virtual consultation, okay? You're going to hit that button. That's going to take you directly to a questionnaire, which you'll be able to fill out. And you're going to be able to upload and send some photos. We're going to need a minimum of 3 photos for most procedures, but if you're doing a Lipo360 BBL, 4 photos would be best, so you can get the front, the 2 sides, and the back. Okay, so I can make a proper evaluation and give you my recommendations. Another thing that always comes up, because oftentimes, especially for something, say maybe like the Miami Makeover, patients are interested in more than one procedure, and the form will only let you put 1. That's okay. Don't worry about it. Okay, just put in your primary procedure, your number 1 procedure, and once you submit the form, you're gonna get a call from our patient care coordinator, and then when you speak to her, which is gonna be an actual real life person, an actual human, they'll be able to then, of course, take all your information and add any other procedures that you want to add at that time, and give you all the information that you need. Okay? All right. Excellent.
Okay, we're almost there. We have 2 minutes and 2 questions.
2 minutes, 2 questions. All right, shoot.
Okay, first one. I got my implants out and want them back. The scar is very low and with keloid. When I got to get my implants, can we get rid of this scar to bring it higher up and pull the skin up? Okay, it's too much info for me.
Yeah.
But if this can be done with a reverse tummy tuck.
Okay, so it's a big question, and of course, honestly, to give you like a good, honest answer, I would have to do an evaluation and really look at your photos and determine, what you're a good candidate for. But can it potentially all be done? The answer is yes, right? We can put in the implants, we can do the scar revision, remove your keloid, and do a reverse tummy tuck all at the same time, if you're a good candidate for that. Now, keep in mind that when we do a reverse tummy tuck, typically then that makes the incision underneath the breast a little bit longer, and so we'll have to be like very, very diligent about how you heal after that to hopefully try and prevent a keloid from occurring again.
Okay, the second one. Doc, please, it's okay to do a breast lift, breast reduction along with an arm lift?
Yeah, that's actually a combination that we can do. So we can combine the breast with the arms, and the breast can be any procedure, but yeah, you can do a breast reduction with lift, and we can do the arm lift or brachioplasty at the same time. All right. Okay, awesome. Well, it's great being back here with you guys. Kind of miss you guys a little bit as well. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. All right, I'll see you then. Take care, everybody. Ciao.